The NHS does not have the nurses it needs. That's the verdict of the National Audit Office in a report today, written before the coronavirus outbreak spread. So how on earth will the health service cope if, as the government warned this week, as many as 1 in 5 people will be unable to go to work? Niall Dickson is Chief Executive of the NHS Confederation, whose members provide services to the NHS. Morning to you, Neil.
Morning.
Overall, we'll go through some detail in a second. That question, can the NHS cope?
Yes, I think at the moment it's certainly coping very well at the moment, in spite of the fact that it's under enormous pressure and hospitals are full and the rest. And as the virus increases, I think the NHS will cope well. Of course, there may come a point when the level of infection is so great that the NHS and doctors and so on have to make quite difficult choices about who to treat and when to treat them.
Just spell out what that means, because that phrase difficult choices means a great deal. Does it mean the brutal decision about is a heart attack victim more or less significant than someone who's ended up seriously ill, and not everybody will, as we know, with coronavirus?
So if you take something like intensive care, people make those kind of choices at the moment. The answer is there'll be more of those kind of choices going forward. Things like intensive care, we've got 4,000 beds, but we will be able to flex that, so there will be more, and it's mostly about giving respiratory support to people, so that we can put in many more beds like that, which are sort of intensive care beds, which will be able to treat larger and larger numbers of people. But there may come a point where you say, well, I'm not going to move somebody into hospital because, A, the movement itself might be more difficult. We may not have enough respiratory stuff to deal with absolutely everybody at home, but none of us know there. And I think the point, again, this getting this balance between over reassuring people, the answer is we think that we are probably one of the best systems in the world in terms of trying to adapt to this. I think so far we've been quite successful at containment. We see each day, of course, the numbers are going up, and the system itself is starting to change. So we were concentrating on specialist units, treating everybody in those. Well, we're now adding 19 specialist units. We'll now start to say to hospitals, expand what you're doing so that you have more areas for people who have coronavirus.
So there are some simple things you can do. You can cancel routine operations. You can treat all but the very, very ill with coronavirus, some of them or many of them at home. You can expand the number of beds, which you've said. But then we come back to nurses, which was the subject of this report. And people say, first of all, there aren't enough now. And if anything like 1 in 5 nurses were ill, and that was the figure that the government came up with for the working population as a whole, then you'd be in real trouble, wouldn't you?
Well, I think the issue of staffing is actually less about our current shortage, which is very significant, and the government is right. We do need to invest more, and we need to change the way in which nurses and others work in the service so that they are working at the top of their licenses and are absolutely effective. So all that stuff aside, but in this kind of emergency situation, of course, we'll be pulling in people, not just the retired, actually might need to be a bit careful of older workers and bringing them in, but certainly, for example, there are lots of people working in academia at the moment who are doing part-time teaching, maybe doing a bit of clinical work. Those kind of people we would absolutely want to bring over. I think I would say this message to the government. In the budget, we are expecting something on pensions. We absolutely want to make sure that any doctors who are asked to do additional work over this period are not worried about the fact that they're doing extra work and are actually doing it for less than nothing.
Yeah, to be clear, this is about the pensions of better paid workers, not the state pension. Yeah.
No, it's about the pensions, the NHS pension that they receive. So there's something very immediate that the government could do.
Last question, Neil. I mean, you've been around the block. You've done a lot of jobs in health. Of course you were. People remember your voice very, very well. You used to report on health here at the BBC. That question that, slightly jokingly, I think Prince William raised today, is the media overhyping it? Where do you think we've got to? Are we in the right place? Are we overreacting? What's your instinct?
Well, the media is not a homogeneous thing, as you well know, Nick. So, of course, there are bits that are very excitable and are pushing things. And, of course, now, different from when I was in these studios in a different capacity, we've got social media, which, again, affects the way that people think. So, again, I think it is really important that people go to trusted sites. And, of course, people are suspicious even of government and what they're saying. But generally, I believe that the stuff that is coming out of the centre, and certainly at local level, our members will be putting out information, try and follow the official advice. And of course, there's really important advice about what individuals can do to try and contain this virus.
Yes, don't, as one woman has been photographed on the tube, put a plastic box on your head and travel on public transport. That's not going to do you a lot of good, is it?
Perhaps not.
Niall Dickson, Chief Executive of the NHS Confederation, thanks for joining us.